We're going to be talking about, we want to start these 30 days of uh, fertility basics for women. We want to start these 30 days with regular periods, right? What regular periods mean? Because, of course, regular periods does not automatically mean fertility, right? So we want to look at all the details. So you want to make sure you stick around and learn everything you can learn. Is that okay? Tonight we want to talk about how that regular periods don't mean don't mean that you're fertile. You know, people ask the question, but I'm menstruating regularly. What's happening? I've not conceived yet. All these many years. All right. So let's give you some clarity, right? Let's give you some clarity because, like I always say, majority of the infertility concern around the world is ignorance. Not that it's something really serious. It's just ignorance. Because if you know, you'll find the solution even by yourself. Is that okay? So for those who are just joining, please tap on your screen, share the live, follow me, and drop a heart me. These are just the ways you can help what we are doing, right? And by the way, by June we should have completed our target of 20 people who will conceive, right? Who will conceive? 20 people. I think it's eight more to go. 8 more to go. We already have 12. 8 more to go. So you want to register your name in that list, right? All you need is knowledge. Yeah, if you have nothing wrong, but still you don't conceive, that's why I'm here. I want to bring you clarity to that question. Is that okay? So I want to stick around and engage so that other people can find us. Is that okay? And if you are not following me yet, please follow me. Please follow me. And if you've missed any of our episodes, just go to YouTube, search my name, Dr. Godwin EMB. Dr. Godwin EMB. All the past episodes, especially that has to do with male infertility. We've done an extensive discussion for the past 30 days. And I know that men nowadays, those who have been listening to me, they should be producing precious sperm. I know, they should be. You cannot miss it for anything, right? So you don't want to have intercourse with that kind of person because they will knock you with no good. All right, that's what knowledge would do. I know we said to you that 9 out of 10 infertility problems in men are reversible, right? But why are men still suffering infertility? Because of lack of knowledge. Lack of knowledge. And that's why we are here. So we are beginning the next 30 days today, and we're going to be talking about fertility basics in female, right? We'll touch a lot of things, which will include PCOS, AMH, and all those things that some of you are asking all the time. So that's why I tell you, if you have plans of missing my live stream, you miss too much, because I give you what money cannot buy, right? Now, you see this tonight's discussion. This is an assumption that misleads many women. Regular menstruation. And they say, and I'm not pregnant. It's an assumption that misleads many women. And one of the most common belief in fertility is my periods are regular, so I must be fertile. Really? You think so? It sounds logical, yeah? It sounds logical. It feels reassuring. Of course, I have regular periods, so it feels reassuring. And in many cases, right, it's partially true. It's partially true. So in the next 30 days, we will do justice to everything in this direction, so that that question in your mind will be answered. Then you now know how to try correctly. Is that okay? You should be trying correctly, because regular periods do not automatically mean that ovulation is healthy. No, it doesn't. It doesn't mean that the egg quality is optimal. No, right? Or that pregnancy will happen easily. No. So regular periods does not mean all that. Thank you, Dr. Pat. Dr. Pat is here. Christy LaBelle, I see you. Those of you that are just joining, you are welcome. You've not missed anything. We're just beginning. And this is the beginning of 30 days of female fertility basics. And all those questions you have in your heart, we will begin to answer them one after the other. Right? So I was saying that this assumption, right, that I'm having regular periods, therefore I should be fertile, this assumption has delayed many diagnoses and treatment for many couples. You're just there waiting. My period is regular, and you're just there waiting. 1 year gone, 2 years gone, 3 years, 5 years, and you're still waiting. When are you going to get evaluated? Right? When are you going to get evaluated? Well, let's help you with some knowledge, so that from here, you begin to know how to handle your fertility journey. What does regular period actually mean? What does it mean to have regular period? Right? Who is ready for this gist tonight? Please, let's keep the likes coming up, right? Let's keep it coming up, and let's keep the shares coming up, so that there are people who are trying to conceive. And one of the things you don't want to wish your worst enemy is infertility. Right? So, and the way to help is to tap on your screen, share the light. So who's ready for the gist? Talk to me in the comment section. Just type ready. Then we'll continue, because I want to ask and answer the question: what does regular period actually mean? What does it mean to have regular period? So please tap on your screen, share the live, then we'll continue our gist. Ready. Oh boy. If you are just joining, you're welcome. Now, thank you for the likes. I see you. Thank you very much. Now, a regular menstrual cycle typically means that the cycles occur anywhere around, you have a 21-day cycle up until a 35-day cycle. Right, depending on which bracket you are. Some people have 21-day cycle, some have 35, some have 28, some have 31, and so on. Right? And you can predict the cycle every month. You can predict the time every month. Right? Now, if you're looking at this from outside, this will suggest that it actually suggests that the hormonal system is functioning. Right? I'm having regular cycle, therefore I have no hormonal issues. Right? Right? But again, remember, if you have been here, remember that menstruation is just one visible part, right, of the complex processes that have to interact for fertility to happen. So menstruation is just one tiny visible part. Is that okay? So regular cycle means you can predict your cycle every month, and it's anywhere 21-day cycle, 35-day cycle, anywhere in that bracket, and you can predict when it's coming every month. Right? Now, menstrual cycle has multiple phases. Yeah, we will not go into all the details of the many phases, but I will just mention for those who who are still oblivious, right? You have the follicular phase. We have the follicular phase is the egg development phase, right? Then you have the ovulation. Ovulation is actually when the egg is released. It's just an event, just a momentary event, right? That's ovulation. There's the luteal phase. Luteal phase is where the body begins to prepare for pregnancy, assuming that pregnancy occurred, right? Then you have the menstrual phase. Menstrual phase, of course, is the shedding of the uterine. So these are the 4 phases, right? And a regular period only confirms that the cycle is happening. That's what the regular period means. It confirms that the cycle is happening, not that every of the phase is optimal. There's a difference. That something is happening does not mean that it's optimal. Is that okay? Now, the missing link, where in the case of infertility, one of the missing link will be in the area of ovulation, right? Because you can have regular bleeding without proper ovulation. There's people come here and said, "Oh, I've been trying for 2 years, 5 years. I don't know what's going on." It's not, the bleeding really is not the matter. The question is, are you actually ovulating? Anybody can have menstrual bleeding, right? But if you are not ovulating, that's where the matter is. Others will say, "Oh, I've not been seeing my menses for the past 5, 10 years now. What's wrong with me?" Well, I still ask the question, can you confirm ovulation? If you're ovulating, that's just what we need to get moving, right? That's just what we need, right? Because ovulation is the key. Mirage, the unusual, is here. Hello. Right? So I was saying that you can have regular bleeding without proper ovulation, right? And where there is bleeding, regular cycle, and no ovulation, that is called an ovulatory cycle. In other words, a cycle that does not have ovulation. That's what it's called. And in such cases, you have hormonal fluctuations, or the hormones fluctuate enough to cause bleeding, but not enough for ovulation to take place. Comprehend? If you don't comprehend, tell me that you don't understand. Right? If you don't understand, say I don't understand. Then I'll go back. So you have bleeding happening because the hormones are fluctuating enough for that bleeding to happen, but egg is not released. And without ovulation, forget about pregnancy. Because that is the key. That is the key. Some people have subtle ovulation problems. Yeah? Even when ovulation occurs, it may not be optimal. Anike, I see you. Thank you for the taps. All right. Now, the simple or suboptimal ovulation issues could be anywhere from delayed ovulation, right, to weak ovulation, to poor egg development. These are the issues that can occur. And these issues may not affect the cycle regularity. So you can still have regular cycles, but infertility is still a challenge. They're going to affect your fertility, certainly. Right? Good evening, Evelyn Obika. You're welcome. Right? You know, in all these things we are talking about, there is always one invisible factor. And that factor is the egg quality. It's not enough to have eggs. What is the quality of that egg? Right? It's very key. And if you have been here, we've talked about this extensively, because I would really want to talk to those that are trying to conceive this year. If you're trying to conceive this year, this discussion is for you. Right? I'm sure by the time you achieve your success, next year we will hardly see you. Right? Okay, Christy Labelle said you are shining. I'm sure this 1 week break looks good on you, right? When I went for this 1 week break, I applied everything I taught men to do to produce precious sperm. And anybody that produces precious sperm will shine, right? Certainly. You cannot produce precious sperm and not shine. No, it's not going to work. Please, sir, something is bothering you. Okay, for those who are trying to reach me on my green app, please, the only way you can reach me now, go to my bio. There's a link there. Tap on it. It takes you to my store, the front of my store. Search fertility consultation. When you walk yourself through that, it lands you to my DM and the green app. So I think that makes it easier, so I don't get to talk about it over and over again. Right? Sir, please, I want twins. Can I take Clomid? You see why some of you are spending money. Ikojo. Who told you that Clomid is for twins? Oh boy. All right. So if you want to get to my DM, use the link in my bio. And just click on what concerns you, because there's a lot of things I do on my digital store. So go to fertility consultation. That's the one that concerns you. Tap on it and walk around it. Is that okay? So I was talking about the invisible factor, and that is egg quality, right? Egg quality. That is the chief in the gist. Is that okay? Egg quality depends on 3 things. These 3 things I'm going to mention, right? Ikojo, go and see your doctor. Who told you that Clomid will give you twins? We'll talk about twins sometime in the year, but certainly not today. Just make sure you follow the live stream, because there's so much information on fertility that you don't want to miss out. Is that okay? So let's stick to today's discussion. Thank you for the follow. Those who are following me, I will follow you back ASAP. Right? So I said egg quality, right, depends on 3 things. The first one is age. How old are you? Age. We'll get to that details. The second one is hormonal balance, right? And the third one is cellular health, which by implication, your overall health, right? Now, a woman may ovulate every month, but still have difficulty in conceiving if her egg quality is compromised. Every month menstruation would not mean anything if the egg quality is compromised. We'll talk about egg quality in details, right? Because this becomes more relevant. Egg quality becomes more relevant with age. How old are you? Right? How old are you? And I have said this many times, and I'm telling you, if you desire to have children in this world, do it early. I know those who are suspending starting a family because of career. It is good, but it's a trade-off. It's a trade-off. right? So I'll get to all that, but let's go to luteal phase problem. Remember, luteal phase is where the body expects that pregnancy should occur, right? So let's look at the problem that can occur, because after ovulation, the body produces progesterone, a very wonderful hormone, right? It produces progesterone, and progesterone does a lot of wonderful stuff. But one of the most important parts is support implantation. What does it do? It goes to the uterus and see how to make sure, when you're expecting a new baby, what do? You buy the baby cot, baby everything, preparing your home, even designing the wall to look the way it will be right for your baby, right? Even the body does the same thing. So, and that's what progesterone does. Progesterone is produced to prepare for this baby's coming, for implantation to happen. Now, if progesterone levels is insufficient, these are the things that can happen, right? You can have uterine lining that is not properly prepared. You see that uterine lining that is taken every month is progesterone that has that job. So if for some reason progesterone does not do its job, or progesterone levels are low, the uterine lining will not prepare for implantation. Implantation will fail. Then that also can amount to early pregnancy loss. So many of the early pregnancy loss is as a result of insufficient progesterone. And this is what we would term as luteal phase defect. Your doctor will help you to look in that direction, right? It's not something you know normally, but your doctor will help you. But importantly, period may still appear regularly, regardless, right? Even with the luteal phase defect, you can still have periods. All right, I want to stop here. Guys, I need you to follow me. I need to tap on your screen, and I need you to drop a heart me. That is the only way you can support what we are doing to get people who are trying to conceive to benefit from it. Otherwise, you are just gatekeeping, keeping the information for yourself alone, and that will not be nice. So tap on your screen, share the live, join the fan club by dropping a heart me. And if you have missed anything at all, go to YouTube, search my name, Dr. Godwin EMB, right? Search the name. All the former or past episodes, rather, are there. Learn, and make sure you subscribe. Make sure you subscribe. Martha is here. Hello, Martha. Right? All right. And if you want to get to my DM, go to my bio, the link that is there, tap on it. Look for fertility consultation. You get me there. So that's as easy as that. You go straight to my green app. So no more stress. It's like, good evening, Martha. How was your day? Good to see you after 1 week. Oh boy, my research was worth it. Thank you very much, Martha. So now you can have normal hormonal levels, but not optimal hormonal levels. All right. Now, the thing is, basic hormonal tests may fall within the normal range. When you go for the test, it's, oh, your hormones are good, you're good, right? You can have that on your test, but it's not enough to have a normal hormonal test. It's not enough. The question is it optimal? Not just normal, it's an optimal level, right? Why? Because when you have small hormonal imbalance, it can affect things like ovulation timing. Just a small swing of hormonal levels can affect the timing of ovulation. It can affect egg maturation. It can affect uterine receptivity. In other words, the ability for the egg, rather the embryo, to attach itself to the uterus. These are the events that happen that nobody tell you about, right? Because this subtle change can go unnoticed. And in the coming days, I'm going to tell you about these hormones in details, so that the next time you go back to your clinic and ask questions, you'll be asking the right questions, right? You'll be asking the right questions. Now, because today is the beginning of the 30 days of female fertility basics, it's not going to be long, right? But I want to give us conditions that can exist with regular periods. You have regular periods? You're still trying to conceive? Let's talk about it. The details will not come today, but I just want to mention them so that in the coming days we'll deal with them in details. Is that okay? Good evening, Rosemar. You're welcome. Let's look at conditions that can exist with regular periods, right? You see, there are several fertility-related conditions, right? And these conditions can be present even with your regular cycle. So if you are stuck on my cycle is normal and regular, and I'm still not conceiving, well, hold on, let me finish with this matter. Then you understand. Now, well, you can itemize them yourself if you are really following. I will know. The first one that can happen, right, is mild polycystic ovarian syndrome, right? I'm going to deal with that in details in coming days. So if you have a PCOS problem, you want to make sure you stick around 8 p.m. Nigerian time every day, Monday to Fridays, no weekends, right? So stick around because I'm going to be talking about you, right? But for today, even with your regular cycle, you could still have mild polycystic ovarian syndrome. Underline the word mild, right? Because some women with PCOS still menstruate regularly, but they may have poor ovulation quality. Yeah, they may have hormonal imbalance, right? So this can affect fertility, even though your menses is regular. So that's why you need evaluation, right? The other thing that can happen is endometriosis. If you've ever heard about it, I'm sure in the coming days we're going to deal with it in detail, so that I want to help you with the knowledge that would give you clarity. Is that okay? Endometriosis, you can have periods that are regular, yet the environment around your pelvic area is inflamed, right? This is an inflammation that affects the pelvic area. Remember, the pelvic area is where the whole engine room is. Is that okay? And anything that affects the pelvic area will also affect fertilization and impair implantation, right? And that is key. So what are we talking about? Regardless of your regular periods, these things can occur. These things can be present. These conditions can be present. Reason why you need to be evaluated. Don't just sit down there and say, I'm having regular periods, so nothing is wrong with me. Uh-oh, I want to disappoint you tonight, right? Just make sure you see your doctor. Some of these things are things that can be handled, so it's not it's not all bad news. Is that okay? Some others will have thyroid disorders, right? Thyroid disorders, and even if it's mild thyroid imbalance, because thyroid is a gland that is here, and the hormones it produces also affect fertility. So even the mildest change in that balance can affect fertility. Hi, Mrs. Kamara. Good to see you. You're welcome. Good to see you. So the mildest change can affect your fertility, even with the regular periods, even with the regular cycle, right? So thyroid disorder is a thing. Right? There is also the one that many people are conversant with. Good evening, long time. Love, long time. Yeah, I went on recess so that I can practice all the things I taught men. Right? Remember the 30 days of male infertility? How I taught them how to produce precious sperm, right? So I took 1 week to go and learn all that myself, and I'm sure I'm good to go. All right. Thank you, Love. Good to see you. All right. The other condition that can exist even with the regular periods is hyperprolactinemia. A lot of you know about it. What about having pregnancy sign? And please ask that question when we get to Q&A, right? So that I can just focus on this. Is that okay? Right? Hyperprolactinemia. This is a situation where you have elevated levels of prolactin, and these elevated levels can interfere with ovulation and hormonal balance. Reason why it's a problem in fertility, right? That's the reason why it's a problem. Hyperprolactinemia is a matter, right? But now, with all that, let's say you have regular periods, your test checks out all fine. Remember, another factor that must be considered, which I usually consider it to be the first thing, is the male factor. The one we talked about 30 days past now, the male factor. What is the male factor? Sperm quantity and quality. I don't think those following me in this place, they don't have any problem with sperm, right? They don't. If you do, just go to the link in my bio, come to my DM, sharp. Let's solve the problem. You don't need drugs. Is that okay? I know that somebody wants to sell you a capsule that will change things. I know, but come, we will help you. Where was I? So male factor should not be overlooked, right? It's one of the first things you must test while you are trying to conceive, so that you don't waste your time. Don't waste your time. Now, besides the male factor, Salome said, anyway, there's also the issue of timing. You may have quality eggs, you may have regular cycle, everything just all right. But are you knocking at the right time? Right? And for those of you maybe from around the world who don't know what knocking is, are you having sexual intercourse at the right time? So many of you you're just knocking at the wrong time, right? You are knocking, but at the wrong times. So please make sure your timing is your timing is properly timed. Is that okay? Because if your intercourse does not align with your fertile window, you're just wasting your time. Hi, Braid from Canada. Good to see you. You're welcome. Right? So your knacking time should align with your fertile window. So if you are knacking outside your fertile window, you are just knacking for fun, right? No, by the way, there's nothing wrong. There's nothing wrong with knacking for fun. There's nothing wrong. What I'm trying to say, if you are trying to conceive, you need to knock at the time that you can get the result. Good evening, Juji Lat. I see you. Folly Shade, it is possible if you have a short cycle, right? If you have a short cycle, you can have 2 menstruation in 1 month, but I'll deal with that when it's Q&A, right? So now what about, let's look at this, the issue of cervical mucus and cervical environment. By the way, if you have not seen the cartoon video on my profile, hi, Reef, I can't pronounce your name, but good to see you. You're welcome. So go to my profile. There's a cartoon video on what sperm had to go through, right? Go and check it out. It's funny, but it is what it is, right? It is what it is. Hi, Miss K. Good to see you. All right, so cervical mucus and cervical environment. That's another important part of the gist. Very important part of the gist, right? You know, fertility also depends on the cervical environment. You see this cervix? Women, you see that your cervix is a very important part of this fertility journey, right? Very important part. Even with ovulation, let's assume ovulation occurs, or let's assume there is quality egg. Yes, you will get pregnant early, but you need to listen to me first, right? Listen to me. Is that okay? So I was saying that even with ovulation, even with quality egg, right? Poor quality cervical mucus can block the sperm, because that's what the mucus does. That's what it does. It blocks the sperm from passing through. In one of these days, I'm going to talk about the cycle with respect to the cervix and how it changes across the months, right? So that you understand what sperm had to go through. Sometimes, some of you will need IUI to solve your infertility problem. Why? Because IUI gives the sperm head start, right, for easy fertilization. Do you understand what I'm saying? Because your cervical mucus is too thick, blocking the sperm from passing through. and so it doesn't matter how quality the egg is, it doesn't matter how quality the sperm is, the mucus is just hanging there, too thick. Every sperm that comes is blocked, right? So where there is a poor cervical mucus, it blocks off the sperm. All right, we'll answer that question, right? And it also can be unfavorable with respect to its pH. And when there is pH problem, survival for the sperm becomes a serious issue, right? A lot of things can affect the pH, but we'll deal with all that in days to come. So today I just want to introduce the 30 days of female fertility basics. Today is just an introduction. So for those who are really interested in the gist, you want to keep coming. Monday to Friday, every week of the month, 8 p.m. Nigerian time. Right? 8 p.m. Nigerian time. And do you know that this cervical mucus issue and cervical environment is one of the rarely discussed aspects of fertility? Nobody really wants to consider that area, but you need to consider it because it can be part of the problem. It can be part of the problem, right? So we'll deal with all that in time to come, right? Also, understand this. I know you have regular periods. I know that you are just confident in yourself. Understand this. Regular periods is not equal to ovulation. No ovulation, no pregnancy. So periods is not the factor here. Period just tells us that something is going on with your hormones, which is good. Any update on TTC leak? That's a good question. I will get to that. Right? So, no regular bleeding does not mean ovulation. So bleeding can occur, but without egg release, there's no pregnancy. Forget about it. Ovulation is not also equal to fertility success. That you're ovulating does not mean that you will conceive. Confusion, right? Is there a WhatsApp group? Not where we used to have, but the people that came there were not so serious. So for now, I'm just doing a one-on-one consultation with those who are interested. Is that okay? But I'll consider that much later. So ovulation does not always mean fertility success. Why? Because egg that is released would have to be quality egg and would have to meet the sperm at the correct time. So these are the things that will guarantee pregnancy. Not that egg was released, therefore I was pregnant. No. Is it quality? Was it fertilized at all? Right? Mrs. Kamara said, knack to save your life. Exactly. And like we say, knack waiting no good, right? So I said all that to say that fertility is a multifactorial thing. It's multifactorial. Fertility requires healthy sperm. Fertility requires healthy egg. Fertility requires proper timing. Right? Fertility requires the optimum uterine environment. So it's not just one thing that is hindering you. It may be one or many of these things. But in the coming days, we'll look at them in details. And I'm sure by the time we are done, many of you will go back and test positive to pregnancy, because we'll give you practical steps that is going to help you. Now, if periods are regular, but pregnancy is not occurring, right? This is when you should be concerned. I know you want to know, when should I be concerned? My period is regular. And pregnancy, when should I be worried that something is wrong? I'm going to tell you now. Regular periods, no pregnancy yet. Now, if you are under 35 years of age, right? If you're under 35 years of age and you have been knocking waiting no good, right? 3 times a week. You know your fertile window, and of course you will maximizing it, right? For 12 months, that's 1 year. So if you've been knocking waiting no good appropriately for 12 months and still no pregnancy, go and get evaluated. That's when you should be worried, if you are less than 35 years of age. Now, if you are above 35 years of age and you met all these criteria, not those people that your spouse is in Canada, then you are working in Lesotho. I'm not talking to you. you are not meeting the criteria. It's not for you. I'm talking about those who are together. They are knocking waiting no good 3 times weekly, and she knows her fertile window, and they are optimizing it. I haven't met that criteria. You are above 35, and 6 months has passed trying to conceive. You have not conceived. Go for evaluation. That is when you should be concerned. Is that okay? It is time for evaluation. So what do we say? Those below 35 years of age, you need 1 year to try. If there is no result, go and get evaluated. For those above 35, 6 months to try. No results, go and get evaluated. Stop sitting down and be waiting. I don't know what you're waiting for. You're just wasting your time. You understand what I'm saying? Stop wasting your time. And there are things to be checked, right? A proper fertility assessment would mean that you have confirmed ovulation. That's why sometimes some people throw some questions, and I keep on asking them, can you confirm to me that you're ovulating? Because you don't just ask questions out of the blues. There are certain things your doctor would have helped you with, right? So one of those things that should be checked will be to confirm ovulation. Is that okay? Confirm ovulation. How do they do it? They'll do that by checking your progesterone levels. You can also do that by ultrasound tracking. That is folliculometry, right? Some of you are asking questions. I will answer your question. No, just relax. I'm almost done, right? So calm down. I need you to know something first before you start asking questions. Is that okay? Right? So confirm ovulation. Right? Also, there is going to be hormonal evaluation. You want to ask questions. I hope you are following me. If you are not following me, you cannot ask questions. Right? So follow me. Tap on your screen and share the live. Right? So help other people find us, because I'm talking to those. I want to talk to those who are trying to conceive. Right? There are many of them around the world. So let's help them by tapping on our screen. Is that okay? Thank you. All right. So, where was I? So, hormonal evaluations. Yes, hormonal evaluations. Things like thyroid function will be checked. Prolactin levels will be checked. Ovarian reserve markers, right, will also be checked. So these are important things, right? Then tubal patency is part of the evaluation that you need to do. Of course, your doctor will help you with that. Why? Because we need to ensure that the fallopian tubes are open. Because I haven't done everything else and your fallopian tubes are not open, it's just a waste of time, right? Well, it's really not a waste of time. You can just go for IVF and rest, right? Go for IVF and rest. So it's important we know that your fallopian tubes are open. Hi, I'm Inata. Good to see you. All right. Then this one, I always advise you to come first. Semen analysis. Semen analysis should not be the last thing to be checked. Semen analysis should be the first thing. By the way, it's even the easiest thing to check, right? It's semen analysis. Do the semen analysis. Let's check what is going on, right? For those of us who were here when we're talking about 30 days of male infertility, remember, what do we say? We now know that every second that passes, a healthy man, I'm talking about healthy man like me, right? Healthy man like me. Hey, a healthy man produce 1,500 sperm cells every second. That is about more than 100 million in 24 hours, right? So it's important we check the semen analysis and see how to boost it if necessary, or how to salvage it because sometimes most of these things is just to change lifestyle and stuff. The solution is just simple, but these people they just want to be deceived. Anyway, so semen analysis, make sure you do your semen analysis as part of the first things to be done. Is that okay? When you do all this, when all these evaluations have been done, your doctor can now zero down on exactly what your problem is and the treatment option that is relevant to your case. We all don't have the same issue. So you cannot say the other person did not conceive for 5 years when they gave her these herbs. Those of you with herbal solutions. Right? I know they work, but I can only speak of what I know. So you cannot say because that person took herbs, therefore when you take herbs, your solution will come. Wrong. You cannot say because that person took what do they call it now? Supplements, therefore when you take supplement. Have you evaluated at all? Or you are just running your fertility on assumptions? Don't do that. Don't do that. Don't do that. And in the quest of fertility, never be desperate. Do not be in a hurry, because that is a recipe for you to be extorted. It's a recipe for you to be taken advantage of. Anyway, a lot of you want to be taken advantage of anyway, so so if that's what you want, you can continue in that direction. But calm down. Let us walk you through this journey. And you carry your baby. You see, with respect to regular periods, right? Many women feel confused when they have regular cycles, but yet they still struggle to conceive. It's confusing. There's also often this sense of frustration that comes with I'm menstruating every time, but what's going on? There's the sense of, there's even self-doubt. I don't know what's going on. And many of the questions, they mostly will go unanswered. Right? So when you understand that regular period do not equal or guarantees fertility, it now helps you to shift your focus towards proper evaluation. Don't sit at home and assume. Go for proper evaluation, because the evaluation will determine what solution is available to you. Is that okay? So, with everything I've said, I'm just trying to help us establish, right? Because in the next 30 days, we're going to break down a lot of things. I just want to help us to establish. Just understand that fertility is not defined by one sign. Because I'm menstruating, therefore I'm fertile. No, it's not defined by one sign. It's not just one thing that determines fertility. It's a result of a multiple complex system that have to work together. Right? You need hormonal balance, you need egg quality, you need sperm quality, you need proper anatomy of the pelvic, of the reproductive system, right? Even timing is key. Mama, good to see you. You're welcome. Regular period is just one piece in the whole of the block. Just one piece. So you want to calm down. Let us help you. Lay it all out there. Is that okay? So before we begin to take questions, I just want to buttress. Son of Jacob, I see you. You're welcome. Understand that it's possible that the body can appear normal on the surface, right? The person may look healthy, appear normal, but where there is subtle imbalances if there is a subtle imbalance in any way, right, a lot can go wrong. Remember what we said about men in male fertility. Slight temperature change, sleep impairment, stress, all these things can affect sperm quality and sperm quantity. The same thing is happening with women also. So it's not just one sign we're looking for. We want to deal with all the issues. Is that okay? So fertility requires more than regular cycle, right? I love it that you have regular cycle. Thank God for that. But we need to look at beyond the regular cycle, because this whole gist in the next 30 days is we're going to be focusing on precision. We're going to look at the coordination that happens in the body to bring about the results and the optimal function of every step. Because if one step misses out, fertility just go over the bar, right? So in the next 30 days, we're going to look at all the basic things, including AMH, including PCOS, and all those things in details. So that if that is your case, or somebody you know, you are equipped with knowledge to face it without being desperate. And I'm sure you and your doctor will get results in the end, I'm sure. So, all right, before we send your request and come up if you have a question, but make sure you are following me, otherwise I will not answer you, right? Somebody asked about the TTC League. Yes, we were supposed to start the TTC League April 1st. Unfortunately, people that are trying to conceive are not interested in the TTC League, so we just shelf it. And that means I get to rest more, right? All right. So whenever people that are trying to conceive are ready for TTC League, so we'll go back to TTC League. That is number one. Number two, all the episodes that we've done since January, all of them are on YouTube right now. So you want to go to YouTube, type my name, Dr. Godwin EMB. Watch them over and over again. I can guarantee you 80%, if you listen to them hard enough and do what we ask you to do, you will be pregnant. You will. And in these 30 days to come, please, you need to pay attention, close attention, especially because we're dealing with more important things that has bedeviled a lot of women, and many of them still have questions, right? We are going to help you with those questions, but you need to pay attention. 8 p.m. Nigerian time, Monday to Friday is the time. And finally, for those who want consultation with me, just go to the link in my bio, right? Tap on it, search fertility consultation on the search bar, follow through whatever you're asked to do, then it leads you straight to my green app, straight. So the stress has reduced for me, so I don't talk too much. Don't come to my DM on TikTok. It will be a waste of time. Just follow that link and you'll be fine. All right. Send your requests and come up. Send your request and come up. Let's answer your question, then everybody go and sleep, right?
You carry your leg, go meet one prophet, man, where they promise miracle, no scan, no plan. Say your sickness, not village people fight, collect your money, disappear overnight. Now they save you, you go pray. Who tell you truth, you go pray. Well done, turn upside down. Real ones lost, fake ones crown. The doctor know they shine, no be saying no savvy. Not because you know they lie.
Send your requests, please.